at some of these amazing images that we're going to throw on your screen, because these are all breast cancer survivors. They're photos taken by a local New Jersey photographer. Her name is Michelle Boncourt.
Yeah, she's the co-creator of BeautifulSelf.org, which is a nonprofit on a mission to empower women to thrive in their new self. So joining us now is OBGYN Dr. Taraneh Shrazian to talk about some of the 3 surprising facts that you didn't know about breast cancer. So doctor, thank you so much for being with us today.
Thank you for having me.
I'm
so glad to hear.
Absolutely. I want to just jump on what Kirsten Cole was talking about with her guests, and that's a lot of people having fears of going to get a mammogram during a pandemic. I'll be honest with you, since having my last child in nursing, and then the pandemic hitting, I haven't gotten a mammogram according to when I should have, and I think a lot of women feel that way. So should we be scared or nervous to go get one?
Absolutely not. I was about to say the same thing, that, it's so important to go out and get your mammogram. It's so good for me to hear, New Yorkers on the street talking about the importance of the mammography, because I can't underscore enough how important it is to get the mammogram done. Breast cancer is the #1 cancer in women, the #1 cancer in women globally, and potentially even the #1 cancer, period. So it's extremely important to get those screening tests.
So what are the latest guidelines then for women right now who want to get a mammogram? Because I'm always pushing the women in my life, especially the older women in my life, my mother, grandmother, to go get the mammogram. What are the guidelines?
Yeah. So the American College of OBGYN says starting at 40, women should go every year. The guidelines differ a little bit with the American Cancer Society, which, as you put up here, say that starting at 45, women should have regular mammography. At ACOG, we really believe that every year starting at 40, all women should have breast screening, because the ability to detect disease early, to intervene early, to treat early is so important at minimizing the disease and being able to treat women effectively. So please go in for your screening test.
It is truly important, and I think a lot of women will think, well, it's not in my family, I'm probably okay, but 70% of women diagnosed don't have it in their family line. In fact, my cousin was diagnosed with it, and she was thinking, where in the world did I get this, because no one else in our family has it. So speak to us about the importance of that.
Yeah, I hear this every day from women in the office. They say, well, Dr. Shrazian, I don't have a family history. Why do I have to go have a mammogram done? Well, interestingly, most women who are diagnosed do not have family histories, right? You just said 70%. And actually, even genetic mutations themselves only represent a very small percent of women that actually are diagnosed with breast cancer. So BRCA1 and 2, which many women are aware of, it's a genetic mutation that predisposes women to breast cancer. It's only a few percent of the breast cancers diagnosed. So it's so important that every woman consider themselves potentially at risk and go in for screening.
There's another surprising fact, was that you're at a greater risk of breast cancer if you've had your first period before the age of 12. So kind of walk us through what exactly that means and looks like. And does that mean that you should get tested or get a mammogram earlier than the age of 40?
Well, we haven't changed our screening mammography age based on your age of menarche, we call it, which is the age of your first period. But women who start their periods earlier just have more years, more reproductive years, where they have more estrogen stimulation to the breasts, more ovarian ovulation function. So that's why it's perceived to be a little bit more risky, because you have more estrogen on board for longer.
Okay, and then you need to know your breast density. I think that's really important, because a lot of times you'll get a false reading or an unknown reading, and there are now 3D exams as well, which will help with that density, correct?
Yeah, that's absolutely right. So there's 3D mammography, which has become pretty much a standard at all or most mammography centers. And ultrasound helps evaluate within that breast density. So women who have dense breasts are at increased risk for breast cancer simply because it's harder to detect lesions. So that extra addition of ultrasound helps the radiographer really see within the density and tell you if there are any small changes, any small indicators of potential breast cancer.
Yeah, but the key is making sure that your insurance will cover that 3D mammogram, which is so very important for a lot of folks because it can be very expensive. Doctor, thank you so much for your time today. We do appreciate it.
Thank you for having me. The health centers and hospitals are ready, so please come in. It's safe. It's really important to have your breast imaging done.
Yeah, I'm glad we're talking about it and really raising the awareness. If you have a breast cancer story that you want to share, everybody, we want to hear from you. So email us at cancerwarriors@pix11.com, and we'll read your responses. In the meantime, though, we'll be right back.